And we will next take a look at a brief overview of the pathogenesis and pathology of rheumatoid arthritis. Genetics accounts for a significant percentage of the potential risk for developing rheumatoid arthritis. The most important component of this enhanced risk resides in the human leukocyte antigen HLA-DR4, the gene for which resides on chromosome 6. It appears that the association between HLA-DR4 and RA is explained by a 4 amino acid sequence in one of the hypervariable regions of the DR beta chain. DR molecules are situated on the surface of antigen-presenting cells, so that T cells recognize antigen as part of an ensemble with DR. Many believe a putative antigen or infectious agent protein or autoantibody perched at that site on DR unleashes the inflammatory process. So important is this site in the pathogenesis of RA that it has been termed the shared epitope. It is noteworthy that the individuals with this shared epitope experience a more severe form of RA with more extra-articular manifestations than patients who do not possess the shared epitope. Because of the interaction of antigen-presenting cells with T cells, this implicates T cells in the pathogenesis of RA. However, there is persuasive data to involve B cells and cytokines as well in the pathogenesis of RA. Indeed, it is becoming increasingly clear that both the innate and acquired immune systems play etiologic roles in the progression of RA. Despite the assumed role of HLA-DR4 in RA, only 1 in 20 Caucasians who harbor the shared epitope ever develop RA. Clearly, there must be other factors that contribute to the development and progression of RA. While the nature of the agent remains a mystery, for years bacteria and viruses have been sought as the initial insult that triggers the chronic inflammatory process. Many researchers believe there is a parallel between RA and so-called reactive arthritis. In reactive arthritis, or an infectious agent in the gastrointestinal tract incites an inflammatory reaction, and individuals carrying HLA-B27, to repeat that. In reactive arthritis, an infectious agent in the gastrointestinal tract incites an inflammatory reaction in individuals carrying HLA-B27. Of course, this similarity does not prove that RA has a similar pathogenetic mechanism. Whatever the inciting agent in the pre-arthritic phase, the synovium in various sites of the body becomes the target of an attack waged by T cells, B cells, macrophages, and synovial cells. The end result is pannus formation, a mass of synovium comprised of inflammatory cells, granulation tissue, and fibroblasts, which envelop the articular cartilage, ultimately causing its erosion. To better understand the pathogenesis of RA, it is necessary to review the functioning of the immune system and examine autoimmunity in greater detail, because RA is a prime example of an immune-mediated disorder.